I'd like to talk about what I've been doing and also how it's helping the city as well. So I'm going to talk a little bit about urban metabolisms, inclusive design, universal design, and how we connect those together, and also some case studies. Yeah, I'll try to push it in 15 under 15 minutes. Okay, so first of all, I'd like to share what I'm thinking about urban metabolisms. So it's a framework that views the city as living organisms, analyze the dynamic flow of energy, resources, waste within urban environments. So the concept of the urban metabolism is examine how cities consume resource, transform them into goods and services, generate wastes, and so it's a living organism. Yeah. So for those I mentioned earlier, inclusive design and university is part of the to make this systems works. So, like I said, that it's a living organism, so you have both inputs and outputs. Yeah, but all the process is how we make those things to be more livable. Okay, so there's a linear how you input the input and also to the cities and also create the outputs. But what we're trying to use is not just linear, but it's more like in circular system. So everything is involving and how we use it. Okay. Okay, so that's just the short intake for the metabolisms, I think, and maybe a little bit about inclusive design and how it will be part of this urban metabolisms. So inclusive design, it's a comprehensive design approach that emphasizes on the creation of environments, products, services, and accessible and usable by all individuals, regardless of their abilities, backgrounds, or demographic characteristics. Okay, it seeks to remove the barrier that might prevent, all of those who use any facility in the cities. So imagine that uh, you can call it inclusive design as a barrier-free design as well, but many cities in the world use these words, use this concept to more inclusive societies as a goal for the city. Aging society has been approaching. So inclusive design, inclusive city is part of the initiative that help we move along. So the core principle of the inclusive society, inclusive design, is to diversity inclusion, yeah, ensuring the design accommodates a wide range of users. To be honest, to be all the users. Flexibilities allow the modification based on individuals' needs. Equity, providing equal opportunity for the access and usability. So there's a challenge in the implementing inclusive design. So first one is a cost considerations because it need to be designed for everyone to use. Lack of awareness. People are ignorant. So lots of neglect about different groups of people, different group of races, different group of aging, and then resistant to change. People lazy. People tend to be get used to what they've been doing for so long. Yeah, they never think outside the box. So that's one of the challenge. Insufficient insufficient community involvement. That's another thing. Um, if you look at the statistics, in ASEAN, Singapore is number one, Thailand is number two. We are in absolute aging society, so that's a thing that we need to be aware of. And also, part of the inclusive design, there's a small design we call universal design. Okay, so universal design, what is it? I mean, everyone has seen those uh, words before. Yeah, universal design, it's like a universe. So it's like a big umbrella. It covers every part of the design, which will allow many users to use. If you look at the graphics, people with the cane, people with pregnancies, and also people in a wheelchair. So that's those are example of the groups of the graphic that has been using with this kind of design. So universal design is a holistic design philosophy that aims to create a space, products, and system that are inherently accessible and usable by all the individual regardless of their age, abilities, or background. So inclusive design and universal design is the same thing. So, but inclusive design, inclusive society is more talking about the big pictures. Universal design, it's focusing on the design itself, yeah, like products or everyday products that has been used. And there's a couple of principles that it's with the universal design. So first, equitable use, useful and marketable to prepare for all abilities. Example, automatic doors. Flexibility in use accommodates a wide range of preference and abilities. Example, adjustable chair. Simple and intuitive to use, easy to use, yeah. Easy to understand, regardless of the language, knowledge, experience, or concentration levels. For example, the signage for women's and men's toilets. Yeah. It's easy to understand. Perceptible information, clearly communication, regardless of sensory ability or ambient conditions. Train station platform for the signage for the warning. The tolerance for error, yeah, so it's maximize the hazards and consequence for the accident or misuse, yeah. Car auto unlock, yeah, for example. The low physical efforts, this one is easy. It's like the ramp or the fixture in the bathroom, so it's decided to use with the low energies of the efforts. And size and space for approach and use. Yeah, so approachable size, maybe the desk or the counter level for handicapped people to use. So the challenge in implementing universal design, sorry for the alignment. So retrofit costs, similar to the inclusive, yeah, lack of awareness, the regulatory barriers, balancing aesthetic and functional design. So those are the challenge for implementing universal design within the newly designs. So connection between those three, yeah, which I think is quite interesting. So how are urban metabolism, inclusive design, and universal design related? So I think well-managed urban metabolism system must optimize resource use while creating an accessible environment. Inclusive design and universal design ensure urban development is fair and meet the diverse needs of the population in those systems. So it is in a sense that inclusive design and universal design, it's kind of like uh, organism within the urban metabolism that make all the user, all the cell, it's working together. Yeah. So that's the concept. So the example of integration is infrastructure, public space, public transportations, and waste management policies. So it's everything it's been used within the cities itself. So there's okay, I have 6 minutes. Yeah, I quite managed a good time. So for the case studies, I have a couple of projects that I like to discuss. It's a project involving inclusive design, universal design, and public space. So all the project involving public space and also with inclusive society and universal design as well. So first one, it's about PHCC, a primary healthcare center. It was in Lampang. Lampang, it's another city near my city. I'm from Chiang Mai, the north of Thailand. So the PHCC, it's our basic center, but it's really crucial during the COVID. So it's the smallest units of the healthcare system. It's a backbone in our city that helping bounce back during the COVID. They are the one who give the knowledge to the small community in the village. Yeah. So I got the request from the one of the units in Lampang. Yeah. So they want me to help them redesign this facilities. So first, the concept is quite interesting that when we looked at it, it's kind of like interesting in terms of flow. Yeah. So if you imagine that you went to the hospital, yeah, the workflow is the most important part in the hospitals. How you register, how you talk to the doctor after you get treatment. You wait for the queue to get to pay and to get the medicine and go back home. Yeah. So it's not simple as that. Like in the rural area, everything got mixed up. So I helped them redesign all the workflow and also bringing the nature, humanizations and sensories into the design. Yeah. So that's just the quick concept. And then we construction we constructed it. We get the permit, and how this is a new one. Yeah, so it's make it more humane. Yeah, make it more familiar to them in terms of like a Thai house in the rural area, when you have like not underground, so they're like a ground level while the working is on the upstairs. So people easy to use, yeah, friendly, and also with equipped with all the UD standards facilities. So the second one, I have 3 minutes. So the second one is another project that I did. I got the research grant from the NRCT. It's one of the government agencies who funded research project. So this one, it's about public space for senior activities with the local wisdom context. So this project, the main goal is to study the type of activity spaces and cultural activities in all the part, northern, northeastern, southern, central region, and all in Bangkok, to design a cultural activity space in 5 areas. And also to analyze the purpose guidelines for designing spaces. So actually, this project is quite a big scope because they have 5 areas in Thailand. So I'll give you one small example of what I did in Chiang Mai, where I am conducting myself with this one. So this project, we investigate the concept of the public. It's like a startups in the community. So one of the auntie in the village near Chiang Mai area, she has her own small factories, like half factories, that she get all the seniors in the community to get extra income to doing like weaving of the rattan. But when we this is a new model actually, but so this is the old plans. So we conduct the research. We analyze how the work is going, how the workflow is working. If you look, sorry, it's in Thai. If you look at the left side, you see the process of our process for this factory, small factory, from A to I. Yeah, it's all processing. It's all mixed up. It's unfortunately she's just doing her own style. But then after we plan, we redesign the whole workflow. Yeah, from the first one, from the old version into the new version, which you can compare it. It's way simple. Yeah. So we did this to help her, and then this is perspective, the new one. So we just redesigned the whole thing together. Okay. So that's the second case. So the third case, it's a little bit more bigger in terms of how we develop the public district. Yeah. So this is another project that get funded by the NIA as well. NIA is National Innovation Department, in agencies. Sorry, National Innovation Agencies, only focusing on innovation. So we got the concept from the one of my friends who teach in Faculty of Medicine. They want to do a medical district, yeah, with the words innovation. Everyone's go innovation these days. So we helping them studies. Can we lift up this community? So I'm part of planning and architectural design team. So in this one, we try to create like a big organism that help create the like boost up activities by looking at how we plan accessibility, especially with the people who live in this area, which consists of faculties of medicines, faculty of dentistry, faculty of nursing, faculty of pharmacies, faculty of assisted medical service, and also faculty of nursing. So that's why we try to like think about how the public space, and also we try to put the flagship of the research center in this area as well. So this is one of the design notes that we try to put there, and of course we try to accommodate concept of inclusive design, inclusive society, universal design within these facilities. Okay, that's it. I've used all my 15 minutes.